Are you an active adult or athlete that has either been dealing with or was just told you have a meniscus tear and it's limiting your ability to walk, run, sprint, jump, or even something as simple as just squatting? I'm going to go over today really what meniscus tears are, why they happen, and some of the common exercises we use for patients in the early stages of rehab. How do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab of Point Pleasant, New Jersey, where I have helped countless active adults and athletes get back to doing what they love. Meniscus tears can be a really challenging injury for a lot of people to navigate, whether they've been dealing with it for years or they have an acute injury such as a twisting injury that results in that meniscus tear. More often than not, what we typically see for a meniscus tear is pain with end range flexion. So a lot of times, one of the tests that I'll do, I'll call it a bounce test. I'll have someone lying on their back, I'll bend their knee all the way, and I'll almost bounce the knee out like that. A lot of times people either will feel pain right on the front, almost like the windows of that joint space there, or they'll feel it in the back there. But before we go into recognition, I want to talk about how meniscus injuries happen and why they happen. So the meniscus is fibrocartilage that helps improve congruency of the knee joint where that femur meets the tibia. Not only does it help improve congruency, but it helps with force absorption and really just loading throughout that knee more than anything. So especially with deep knee flexion and twisting activities. More often than not, where these injuries happen are, like I just said there, some type of very repetitive deep squatting or a twisting injury. So someone can plant on their, like put their foot down, plant, and turn, and that's where they can have a meniscus injury there. People that have acute tears will almost sometimes feel it right away, and they might have some associated swelling with it as well. Other people have been maybe walking around with a meniscus tear for 5, 8 to 10 years, and they have one activity that just starts to gradually, over time, worsen their pain more than anything. So that's really how meniscus injuries can happen. What I will say is, because you have meniscus injury does not mean you have to jump right into surgery. The problem with a lot of surgery is when they go and just take a piece of that meniscus out, yeah, it removes the damaged meniscus, but now you're just leaving the subchondral bone and cartilage at more risk because the meniscus is not there to protect it. So again, common signs and symptoms for meniscus injuries are pain, either like right on the inside or even the outside there, or right behind the knee for deep squatting activities, pain with twisting, and that can manifest as, hey, they only feel it with squatting, or they might even feel it with walking, just putting weight on that. Like I've seen a lot of different presentations there. So in cases where this meniscus gets flared up, we want to try to do as much as we can early on. The last thing we want to do is just totally shut down from doing any activity. We want to do what we can to keep things moving. So one of the first things that I'll do here is what we call a banded TKE. The reason I do a banded TKE is to get that quad going. If there is swelling because of this injury, the first thing that will shut down is the quad muscle. So we want to get that quad going. The stronger, more tone is throughout that quad, the more that swelling is going to get pumped out. So we're going to go ahead. We're going to step in the band here, right behind our knee. And really from here, I'm pushing my knee back into that band and coming out of it. Pushing back and coming out of it. As you can see, I'm standing pretty upright. I'm not hipping it like that. I'm pushing back, holding, and then coming in. This should be felt all right on the front of that quad there, pushing back and in. That one you could do for 2 to 3 sets for about 20 reps, and I would say hold each rep for about 2 to 3 seconds, or you could do a continuous hold for like 60 seconds, which is really tough. So I usually have people start with continuous reps before I get right into the isometric hold. After that, I really want to make sure that we start to work on that single leg stability. Again, more often than not, people with meniscus injuries have deficits in either single leg static stability, or if you have to do a single leg squat, that's even tougher, and you will see a lot of just general instability throughout there. More often than not, it's usually due to some type of deficit at the hip, primarily at that glute more than anything, the glute med specifically, so that's what we want to work on. So you're going to take a mini band. I have a relatively heavier one here, but for most people, I'll start lighter and then gradually build up. Right around the knees, you're going to be standing on that just one leg. So say my left leg's the hurt side, I'm going to be standing on that left leg. All I want to do is have a slight knee bend. If you're able to tolerate more, you can, but just a slight knee bend to start, and you're sitting into that back hip. From here, I'm taking this other hip, and I'm opening up to the side. What I don't want is, as I open up, I don't want that band to pull me in like that. I want to keep tension out against that band. I'm not throwing my knee out to the side. I'm just keeping everything in a nice straight line. So we're here and coming back. So that's a fire hydrant. The next thing we'll do is what I call it a mini band skater. So you're going to be back in that same position. All that weight's on that right leg, or left leg in this case. You're standing here. Your other leg, you're tapping back at a 45 and back in. What we don't want is to tap and almost fall back with it. All of your weight is on that front leg. You're literally just tapping with that back leg. So I'm here, tap, and back. And for the fire hydrants and for these, I'm probably going to do about 15 to 20 each set for 2 to 3 sets or so. It should really be challenging to that glute more than anything. One other thing I want to touch on before we end here is hamstring tightness and calf tightness a little bit too with meniscus injuries. A lot of times people come in and they're like, I just feel so tight behind the back of my knee and it's my calf a little bit more than anything. That could be two things from the behind the knee standpoint. One, if there is a little bit of swelling throughout that meniscus, it could essentially just kind of sit towards the back there. So especially a common complaint is people feel pain specifically when they go to stand up after sitting for a while. And that's usually because whatever swelling is in there has been hanging out in just that one spot. So that could play into that too. The other part of it is there could be a little bit of just perceived hamstring tightness behind the knee because some of those hamstrings have a relatively close attachment to that meniscus. So that's another reason why I'm very cautious with how much knee hamstring specific work we add in terms of heel prop ridges, hamstring curls, things like that. Because more often in my experience, a lot of that hamstring work at the knees from a knee flexion standpoint typically irritates it. What I will try to do as soon as possible is a single leg hip hinge because it's not necessarily stressing at the knee. It's stressing more the upper hamstring and the glute at the hip more than anything. So that is a general overview of what the meniscus is, how these injuries occur, how they commonly present, and some of the exercises I use in the early stages. So if you have any comments about your situation or meniscus injuries in general, leave a question below in the comments section, or you could text us at the number below so we can get back to you on how we can help you with a more individualized plan.